We're literally racing to heart attack calls while someone else is on the line, asking for a box of blood pressure tablets. That blunt confession from a South Central Ambulance Service, SCAS dispatcher, is the wake-up call none of us can afford to ignore. SCAS, the NHS trust that answers every 999 and 111 plea across Berkshire, Buckinghamshire, Oxfordshire, and Hampshire, has issued an urgent public plea. If you take regular medication, stop treating repeat prescriptions like a last-minute grocery run. The numbers are staggering. In the last 12 months, emergency requests for routine medication have surged by 61%, with spikes so sharp on bank holiday weekends that call handlers are forced to triage between chest pain emergencies and I forgot my statins conversations. But here's where it gets controversial. Some of these calls aren't coming from forgetful patients. They're coming from people who genuinely believe 111 is the only route left. And this is the part most people miss. The system quietly changed while we were all busy living our lives. Remember when you could stroll into your local pharmacy, tap the counter, and walk out with next month's pills? That door has closed. Pharmacies can no longer accept repeat prescription requests directly. Instead, every order must now travel through the NHS app or your GP practice so a clinician can review it for safety. The shift is meant to cut risky drug interactions and overprescribing, but critics argue it's pushing panicked patients toward 111 at the worst possible moments. So what should you do before the next bank holiday shutdown? 1. Count your tablets this weekend. If you'll run out within 7 days, request a refill now, not Friday at 4:59 p.m. 2. Download the NHS app. It's free, secure, and usually faster than redialing 111. You can order, track, and even switch pharmacies without speaking to a soul. 3. Can't stand apps? Use 111 online. Same system, different screen. It cues you behind true emergencies instead of tying up a voice line. 4. Heading away for the long weekend? Pack an extra week's supply. Pharmacists can't magic pills out of thin air when your local surgery is closed. Jonathan Osmond, SCAS's locality manager for integrated urgent care, puts it plainly. Every minute we spend arranging routine medication is a minute we're not guiding a parent through a child's asthma attack or dispatching a crew to a stroke. Now for the spicy bit. Some healthcare professionals whisper that the 61% spike isn't just forgetfulness. It's a symptom of a deeper problem. Are GP practices too hard to reach by phone? Has the NHS app rollout been too quiet, leaving older patients in the dark? Or are we, the public, simply getting worse at adulting? What do you think? Should patients shoulder 100% of the blame, or has the system set us up to fail? Drop your take and any horror stories in the comments. We're listening, and so is SCAS.